well, the hypoxia is also a really big issue
Mm.
with endometriosis and chronic pelvic pain. That becomes this sort of stagnation, if you like. So there is this fear around movement and breathing. And of course, the more in pain we are, the more fearful we are.
Mm.
What do? We stop breathing. We don't breathe properly. We shallow breathe because that's what we do when we're panicked. So the working very often, and that is the beauty of a multidisciplined approach, and sort of working with a very in tune and qualified body worker that can actually show a woman how to move appropriately through her menstrual cycle and be able to oxygenate and be able to move blood is very, very, very important, and to learn how to breathe properly.
Mm. Yeah, I mean, again, if you think about breathing properly, if you inhale and you use your diaphragm, which is how you should inhale, what does it do? Expands the abdomen, right? So I can imagine most women, they're in pain. They want to tighten that area, right? Because so there's almost a double-edged sword there, really. But not only would that improve oxygen intake, but it would also make them more parasympathetic as well, which is going to help with pain.
Definitely. Yeah.
The other thing you were talking about there as well, and what I was thinking was, okay, so doctors are prescribing hormone medications or surgery or whatever else, IUDs, etc. What about a discussion on endocrine disruptors from their food supply or from their environment? Oh no, forget all that. Forget all that. We've got the solution. Let's just take a pill, I'm
This
sure.
is why, yeah. I mean, this is not about, and I'm sure it's not about slamming GPs. I mean,
Mm.
it's just like, but they are not, that's kind of, I'm sure that's what's in the NICE guidelines, is that's what's prescribed. So but it is just one component. And absolutely, there is a place for being able to support that woman to stem the heavy bleeding while you can work on all of the other components. But it is just yeah.
Thanks for watching this video, and don't forget to like and subscribe to the channel.